Welcome to YogiViews, where my guest is yoga itself, through interviewing those who practice it, teach it, sell it, or simply love it. I am Antonio Saucis. This is the second part of a two-part show where I'm interviewing Nicole DeAvilla. Nicole is an Ananda Yoga Therapist with a background in sports medicine research, chiropractic physiotherapy, dance, and writing, and is also the author of a book entitled The 2-Minute Yoga Solution, Fast and Easy Stress and Back Pain Relief for Anyone at Any Time. She was one of the pioneers yoga instructors in prenatal and postpartum yoga and yoga therapy, and is currently a member of the International Association of Yoga Therapists Accreditation Committee. Ananda Balayogi Bhavanani, who's a fantastic yoga therapist and yoga master, he coined this term yogopathy, because what he says is that we should keep yoga into the equation and not address the therapeutic process with the allopathic model where you know it's just what you do 3 and 4 of these for that knee, and then don't do the other one, and that's it. So this is what you're...
Well, I love Ananda, first of all, and I totally agree with him. And one of the issues we have in the yoga community actually is finding a balance with that. So there are some very good and I stress high quality trainings out there where they're taking medical professionals, so it could be doctors, nurses, physical therapists, and saying, here's yoga therapy techniques. Here's the training for you so that you can add yoga therapy into your practice. And I think that's a wonderful thing. I'd love to, you go to a doctor and your blood pressure's high, instead of just saying, I'm going to write you a prescription, let's try a little breathing, see what happens here. The issue in the community is, can we call those medical professionals yoga therapists? And there are some who are saying, well, yes, they're doing yoga therapy with their patients, but both the Standards Committee and the current Accreditation Committee and many who support this say no. First and foremost, you need to be a yoga teacher. So it's not to say there's anything bad. In fact, there's everything good about those training programs. But to be a yoga therapist, you really need to be grounded in the whole breadth and fullness of yoga.
Wow. So what are some of those standards? What are we talking about? What have you guys come up with?
Yes, right. So I wasn't on the standards committee.
Yeah.
Our job is to implement them and work with the schools. But they were basically, if you look at, again, the foundational categories of what kind of training a yoga teacher should have. So they should learn about asana, pranayama, and meditation. They should learn the ancient texts that inform. They should know about the history. They should understand basic anatomy and physiology. They should, and on and on. So basically all of those categories that start from that foundation are expanded, and you go deeper with them. Another aspect of it is that they say you have to be practicing. So what they're saying is a prerequisite, and most people will say this is just like the minimum prerequisite before going into a yoga therapy training program, is to have had a 200-hour certification in yoga teacher training and to have been practicing yourself for at least 1 year. And we feel that practical aspect is very important. Another part of the standard says that is the practicum. So it's not enough to just do the book learning. So not only do you need to practice, you need, while you have mentored supervision, work with real clients and real people. So that's another aspect of the standards, is really making sure that the knowledge that they're absorbing is put into practical use with real people. And so they're experienced when they come out.
And so you're mentioning that these things have been added, but I also understand that a substantial amount of hours have been added as well. It used to be a 300-hour training for a yoga therapist. Now we went into 800 hours, right?
Well, Yes and no.
Ah.
So there's a little history behind that, because there are schools out there who for a long time have 1,000-hour trainings, 1,200-hour trainings here in the United States, and that and more in India and other places. I was in Europe recently, and many of their yoga therapy trainings, even yoga teacher trainings, are much longer. Where that 300-hour training came from is Yoga Alliance, which, as you know, registers people who have gone through schools that have been approved who are teaching this foundational knowledge that we were talking about. And they started with 200, I think, because that was the best they could all agree on what those standards would be. And they said, well, we really expect that teachers should be continuing their education. So let's start at another 300 hours and have a 500 RYT. That's where the 300-hour came from, not from anyone really saying
I see.
that that's the amount you need. But it's actually a little bit of an advertising. It's like, come to our yoga therapy, we'll give you 300 hours and you can register as an RYT 500. So it's almost, and then as soon as a few schools do that, you can see how there's going to be other schools doing it, because if your hours are lower, your program costs less. And that's, some people who don't understand really what it takes to be a yoga therapist, they're going to say, gee, I can do this one in less time, get the same
money.
registered RYT 500 as the person who's going to go through this longer, more expensive one. So a lot of people are just going to stop thinking right there and go with that. So it kind of took on its own momentum.
And where is it at now?
Yes. So we found that a lot of schools who are doing the 300-hour training are happy to jump on board and make their trainings be longer. There's some schools who are just very comfortable with what they're doing and would not like to change what they're doing, and and it's not comfortable for them in that situation, and I respect them and understand where they wouldn't be happy with the new standards. But there's a lot of schools who had, maybe it wasn't 300, maybe it was 450 or something, that would have liked to have had longer standards or longer hours of training, but just felt they wouldn't be competitive. And so some of these schools are just really happy. It's like, oh, now we feel that we can be in the marketplace, attract a good number of students, and really give the high quality, comprehensive training that we believe in.
And what happens with the individuals that previously have done their 300 or 500-hour
Yes.
training? They have their certificate, and now the standards are different.
Yes. So one of the things I want to keep in mind is that as we go through this process, we're really only at stage 2. So step 1 was to come up with the educational standards. What should that education look like? So step 2 is, let's get schools who are offering those educational standards. So our committee right now, our main job is, how do we accredit schools? But we're also, how do we help work with the schools and inform them and help them come and bring their programs up? So that's where we are right now. And we don't really have a place for individuals yet to be registered or certified or whatever that term might be. However, we have hundreds, believe me, hundreds, the IOIT phones ringing off the hook saying, what about me?
What do we do exactly?
Yeah, right. I just paid all this money. I'm in a program, or I want to go to this program, but they're still offering it the 300 hours. So what we will be, that next step is implementing a grandparenting program, so that there'll be probably, what we're looking at are 2 tracks. So there will be individuals like you and I who've been doing this for about 30 years and where there weren't even 300-hour trainings to do, let alone longer ones. So there'll be one track for us to be able to document and show that we know what we're doing and we keep people safe and we actually help them. And then there'll be another track for these more newly graduated yoga therapists who went through 300-hour programs, nothing's finalized, so anything I say here could be changed. I want to say that. But what we're looking at is saying if somebody's been through a 300-hour program, they're probably going to need to put in about another 150 hours. It might be mentored practicum versus all classwork. But there will need to be some, probably some contact hours in there, and we hope to help encourage students to take classes that will be, valuable or have, good mentoring opportunities.
It's important that you mentioned that. in fact, because it is an emerging field and because it is a work in progress, we're just discussing that progress. We're not coming up with any important definition or definite system. Now, I've read through the standards, some of them, and I can see that very clearly the physical aspects of yoga and therefore anatomy and structural issues and things like that are very well taken care of or very well, let's say, addressed. Yes. Same thing happens with the mental. The psyche and how yoga and psychology mix and how this works, it's also very well documented. Now, as we know, yoga says that the integration is between mind and body and spirit. Unless I'm wrong, I have not seen any of these issues come up in the standards. Are they there? Are you guys discussing it? What?
They're big issues.
Big issues, yes.
They're big
Exactly,
issues.
yes.
And that's also why you don't see them in a big way in the standards. So a person like me here on the West Coast, Marin County, when I looked at those standards, and the definitions of yoga therapy, I'm saying, hey, I want it to talk more about the spirit, about the soul, because if insurance comes into the picture, if I'm working more with medical doctors and they send me somebody with a back problem and I end up spending my sessions with them talking about their spiritual life, because that's what I can see is helping them and they are improving. And again, I wouldn't just end it with the spiritual life, but if that might be a large component of it, and the doctor's like, well, what have you been doing? I want to feel comfortable that the doctor doesn't say, wait a minute, you're not doing the such and such yoga back protocol I read about in a journal. I want to be protected. I'd like more of that in there. That's the one perspective. We also had some very strong voices of people who practice, say, in the south of the United States, where they said if things about the soul and the spirit are in these standards, they'll kick us out of town, let alone can I have a dialogue and a working relationship with the healthcare providers in the area. So it was a really tricky, delicate dance and balance. So what the intention is, the hope is that that spirit will survive. Yoga survived a long time. And I'm hopeful for a couple of reasons. They did adjust it a little bit so you can, for the person looking for that and wanting to practice more of the spiritual aspects of yoga, you can find that in the standards to make your case that, yes, I'm following the standards, I'm practicing yoga therapy, etc. So it's in there lightly. The other ways it's put in there is the emphasis on the philosophy. So hopefully out of the philosophy, if people are not just using as book knowledge, these are interesting facts, things that happened a long time ago, but actually learning how to apply them and in their own daily lives, because that's what the yoga texts were about how to apply things or the roadmaps that one would find along their path. So that's one. And the other encouraging part is that there are many of the schools who are spiritually oriented schools. The tradition I'm from, the Ananda, from Paramahansa Yogananda's tradition, that have been involved in this conversation. And they have been working with IAYT, and they are putting into place programs. So you will have many examples of schools who are able to really teach in depth the spiritual aspects of yoga therapy. And I also feel that as we do continue to do the research, as long as we're also doing that research, as I said, and showing, I think over time we'll be able to show these comprehensive approaches to yoga therapy are going to get the better results. And I think that will then maybe give comfort and bring more people over to being comfortable with looking at the whole dimension of yoga, which is about the people, and just wherever you are, whatever person you're with, using their language, meeting them where they are.
Now, while other professions have very clear contract between the client or the patient or the person served and the professional, I don't think that we have that, do we, as yoga therapists? A clear contract, a scope of work that is not just an idea, but a paper that you sign and that the client signs.
Right. So I think what we have right now are just basically liability forms. We ask them to sign to say, like, any time you move, you're at risk or whatever, and you're so, which is kind of sad, but that's the kind of form we have right now. So right now, that hasn't been looked at. It has been discussed, because that will come when we start after the schools have a process for accreditation and training, and we start to say, like, okay, how are we going to define the individuals? So right now, we don't even know, are we going to call them a certified, an accredited, they're probably not registered, because that could be confused with Yoga Alliance registry, and we don't want to confuse the public. So when we go down that road, that's when those issues will come up and be talked about. And yes, there's going to need to be some discussion about scope of practice. So it's on its way.
Do these standards contemplate the need, or even in the accreditation process, is it important for the schools to do any kind of personality assessment of the individual who's going to be a yoga therapist?
I think they should. And one of the things that we do want to bring out is that there does need to be assessment. So it's kind of an old model, not simply for yoga schools, but I call it Kali Yuga. Kind of standardization, where you have the teacher up front delivering information, and students are supposed to take it in, and and if you attend and maybe pass a little written test or something, then you get graduated. And these standards are not about that. These standards, we really want to try to move the focus away from the hours. We had to have hours to just have some beginning point to discuss and talk about the breadth and the depth of it. So we're really asking the schools, and we also plan to also help with educating the schools who need help with this, saying you really need to assess them, because the standards are about competencies. They're not check boxes. Did you read this? Did you do the anatomy course? But when you have an individual in front of you, can you use that knowledge that you have of the anatomy and the physiology, and how is that informed by their spiritual life and what you know from the Bhagavad Gita, etc.? What can you do? So it takes both a different teaching style than some people are used to, and it's very hand-on. You really need to integrate, and you really need to give, again, that practicum. You need to give the students a chance to be practicing with their teacher right in front of them. Also going out and practicing, letting their student know, can I, I'm a student of yoga therapy, can I practice with you? And my mentor is going to check back in with me. That's so essential. And because the people who don't have that right personality qualities that you're talking about, so no, we don't have that as a test, but the person who doesn't have those qualities is not going to do well in terms of showing that they're competent in the competencies, we call them.
Yes. So it would be more a practical discerning mechanism. Yes. Because it's quite important. I mean, I'm sure you're aware of how many times have we heard from students that are coming to yoga therapy, as you said, as the last resource. The very common complaint that the doctor was not approachable, he was not interested in me, I was just a number, and so these things are important. Who the person is quite important. Now, when one goes and teaches in a yoga therapy training, we usually, I don't know if this is your experience or not, but regardless of how well thread the information is by the directors, by the mentors, a lot of students are like deer in the light. They are like, ah. And I believe, and this is why I want to ask you, because the time of the geniuses is gone. The time of people that could write about different sciences and a lot of knowledge is gone, simply because the humongous amount of knowledge that we have in this moment about existence. Can a yoga therapist realistically be ready to treat any condition, equally a schizophrenic and a person who has scoliosis?
No. They're not going to be able to treat everything and everybody. And part of the training needs to be, it's very specifically, what are you capable of and when to refer. So it might be when to refer to a more experienced yoga therapist. It might be when to refer to a chiropractor, acupuncturist, orthopedic surgeon, general practitioner, psychologist, psychiatrist. That's part of the training, is when to refer, to know what you're capable of. However, I do believe a comprehensive training would make people be comfortable with any individual in the room. So, number one, if they came across a schizophrenic client, most likely that client is on maintenance drugs, is not too severe for them to just show up in their yoga therapy practice, most likely. And so that they could handle that initial consultation, initial evaluation, but then decide, is this really something that I'm experienced with, well trained, maybe with a little advice from an advisor I could handle, or do I need to refer this person to someone else? Same thing with the musculoskeletal issues. So that they should have that general comfort level, like a general practitioner in a sense would have, to be able to handle those things. But again, it's that basic training. So I think when people go out and they take a lot of specialized trainings, that it can be very overwhelming because they're not really grounded in the foundational aspects of yoga therapy first. And so I would encourage people to get that broad education in that first, like I said, we don't like to use 800 hours, but in those 800 plus hours, to be a very broad training where you do learn a little bit about depression and heart disease and whatever else that is out there to learn in that broad sense, and then go ahead and start taking, as your continuing education, going deeper with these other areas. And that, I think, will really help the student teachers, student yoga therapists, be more comfortable, be more competent.
Yes, I agree with you. It is my experience that the minute you mention referrals, they breathe, they love it.
I don't have to
exactly.
solve
I don't
everybody's
have
problem.
to solve everybody's problem. Exactly. You know that yoga believes, thanks to the integration of all existing things, that things don't appear just by coincidence or randomly, but actually they are a result, or they are in relationship to a need or to something that is happening. Why do you think, what do you think is the need that yoga therapy is serving in this moment, is fulfilling in this moment?
A couple things. One, as we've already talked about, it's comprehensive. Doesn't just treat the knee or just the shoulder, but looks at the whole body, the whole individual. That's part of it. And then also, my personal belief is that anytime you have something chronic, there's so much more going on behind what's manifesting on the outside. And that yoga is so rich with the teachings and the practices that we can do, where we can really go layer by layer by layer and find what's at the root of these conditions that are manifesting themselves. We don't want to just treat the symptoms, and some of these more complex chronic cases have many layers to go through, and yoga has very safe, practical teachings and techniques where you can go through and work with the person on those different layers. It has, generally speaking, there's some immediate benefit of just like, oh, I feel a little better, or I feel hope. Somebody listened to my story and I feel a tiny bit better. So that could be, that initial feeling better, but really having the time to really go at whatever layers need to be uncovered, discovered, and dealt with. And it's just amazing that way.
And if you were to pinpoint one aspect, one concept, one part of yoga that you think is the most appropriate for the modern world, what would that be?
Love. We have so many conditions, disease conditions right now in the United States that are either caused by or exacerbated by stress. We feel stress because of our environment, and the more we don't really feel grounded and comfortable with who we are, the more reactive we are. If we come from a very grounded, centered place of love and understanding, then we react differently to the world around us. And so many of the diseases, as I tell people, because I'll have people who'll say to me, well, as soon as that's out of my life, then I'll be healthy. I'll be happy, I'll be healthy, yeah. I'll be whatever. And I just said, there will always be stressors in your life. I'm sorry to burst that little bubble that you think you can get rid of things and then it's going to be all right. But what we can change is how we react to those stressors. So that's what's so key, is yoga teaches us how to react differently, and that's why the breath is so important. One of the first things that happens when we feel stress is the heart rate goes up, the blood pressure goes up, and we breathe more rapidly. If we notice that, yoga teaches us first to notice, then we can do something about it. Oh, I can change my breath. I've learned a belly breathing or full yogic breath. I can slow it down. I have control. That makes people feel so much better right there. And all of a sudden, all the blood's not going to flow out of my brain, and I'm going to be reactive and emotional and tense, but now I'm in control of the situation and can go from there.
Well, Nicole, thank you. And I certainly would like to talk more with you. Very especially, I would like to talk more about your book. But perhaps you can come back and
I
talk
would love
to us.
To.
Okay.
Be honored to.
Okay.
Yeah.
How would people get in touch with you if they want to?
You can get in touch with me online. As somebody said, I'm all over the web. So there's Nicole DeAvilla Yoga.net. That is one of my websites. But I'm also on Facebook, on Twitter, on Ustream, on YouTube. Sometimes if you just put my name in, or 2-Minute Yoga. Most of the 2-Minute Yoga is spelled with the numeral 2, except Ustream. They made me spell it out, TWO, where I do daily practice with people, Monday through Friday.
Oh, okay.
Yeah.
Wonderful. Wonderful. Well, thank you very much. Thanks for your efforts as a professional trying to help other professionals, and also thank you for your work.
Oh, you're welcome. Thank you for having me.
Very much. My guest today was Nicole DeAvilla. She is an Ananda Yoga Therapist with a background in sport medicine's research, chiropractic physiotherapy, dance, and writing. And she is also the author of a book entitled The 2-Minute Yoga Solution, Fast and Easy Stress and Back Pain Relief for Anyone at Any Time. She was one of the pioneer yoga instructors in prenatal, postpartum yoga and yoga therapy, and is currently a member of the International Association of Yoga Therapists Accreditation Committee. I hope you like our show today. And if you care to let me know, shoot me an email at antonio@yogiviews.com. I look forward to seeing you the next time.